a dramatic leap forward in the care of the modern athlete. Sports Medicine Albany. The treatment your father relied upon to get back into the game just won't make it anymore. Back in the good old days, sprains were left untreated, stretched ligaments never healed, and mangled knee cartilage became the parent of arthritis. Today, at Sports Medicine Albany, clinical innovations, computer analysis, and physical reconditioning get the injured athlete back on his or her feet more quickly, more durably, and with less pain. But first, what really is sports medicine? Medical Director Dr. Rick Alfred.
Sports medicine is the care of the athlete, whether it's the professional, whether it's the high school student, whether it's the weekend athlete, whether it's the 85-year-old person who goes out for a 1 to 2 mile walk every other day. These people are athletes and they need care. Certainly, no one would be foolish enough to suggest that you treat the professional football player in the same manner that you treat the 7-year-old gymnast. They're different people, they have different needs, and they have different injuries. I think it's important to have someone who understands, number one, sports injuries, number two, the certain special psyche that athletes have. It's often difficult to take someone who's very active and keep them out of all activities because of an injury. In fact, what we try to do at Sports Medicine Albany is, granted, someone may injure their knee and they may not be able to bear weight or run and jump, but many times they'll be able to ride a bicycle, they'll be able to do certain other activities so that they're not becoming aerobically unfit and so that they're not becoming out of shape. I think it's important to realize that we can treat and keep in condition other parts of the body while still resting the injured part. I think this is something that needs to be recognized, and I think this is part of our general program at Sports Medicine Albany.
The range of injuries treated at Sports Medicine Albany expands beyond the traditional arena of athletics when one considers the need to treat on-the-job stresses, strains, and accidents. Dr. John Chaika is one of 4 distinguished orthopedic surgeons on the staff of Sports Medicine Albany who cites the trend in the modern workplace toward maintaining the fit employee.
In having a fit worker in your factory, in your office building, makes for a happy worker and a happy environment, and that truly improves the efficiency of an office, of an assembly line, and truly improves upon everyone's outlook. I think that this transcends multiple levels of society, and it's very interesting that today, I think that in today's society there is a lot more time, leisure time available, and that leisure time may indeed be best used to maintain us healthy.
And the great American fitness craze is certainly not limited to the workplace, to a social stratum, or to a particular age range. In fact, we are all running the race of life, and Sports Medicine Albany is preparing professional and amateur athletes to get a leg up at the finish line. The process whereby patients are treated at Sports Medicine Albany begins with an examination by one of the 4 orthopedists on staff. Dr. Rick Alfred, whose background includes being one of the team physicians of the NFL's Cleveland Browns, the NBA's Cleveland Cavaliers, and the Cleveland Indians, demonstrates a post-operative examination on amateur athlete Dan Santandrea. About 3 years ago, the 24-year-old graduate student injured his knee during a sandlot football game. At that time, Dr. Chaika performed arthroscopic surgery to repair the injury. Following surgery, Dan was put on a reconditioning program of physical therapy at Sports Medicine Albany. Everything was going fine until Dan re-injured the knee last year.
Approximately 6 months ago, while he was playing tennis, he suffered another injury to his knee, at which point his knee gave way, and he had significant pain and wasn't able to continue playing at that time. I saw him in my office. The diagnosis at that time as well was made of an anterior cruciate ligament tear, and we discussed surgical alternatives. At that time, we elected to reconstruct his anterior cruciate ligament using a portion of his patellar tendon. And at that time, he was in a hospital for approximately 3 days and then was begun on an intensive rehabilitation program. The rehabilitation program is fairly complex and really requires close supervision by physical therapists and athletic trainers. If you can see, there are several scars associated with anterior cruciate ligament reconstruction. There's a small one about 3 inches on the front of the knee, and also a small, about 2-inch incision on the lateral aspect of the knee. His left knee is the normal knee, and the right knee is the operative knee. As you can see, he has full extension of both knees, and he is able to bend his right knee quite significantly, just about the same as the non-operated knee. The purpose of the anterior cruciate ligament and its function in the knee is to prevent anterior translation of the tibia underneath the femur. In other words, it prevents the tibia from coming too far forward from the femur, and in fact allows you to have a stable knee and to partake in most running and jumping sports. When the anterior cruciate ligament is torn, the tibia or shin bone comes much too much forward and allows the knee to actually give way. It's this kind of scenario, and the knee will actually give out, and people will experience this considerable discomfort and swelling after each of these episodes. The major purpose for reconstructing the knee is to regain stability and also to prevent the recurrence of cartilage tears.
Dan is now intensifying his exercise program, and within 7 to 9 months after surgery, he will be able to resume an unrestricted amateur athletic career. Dan must be faithful to the rehabilitation program at Sports Medicine Albany, because the surgical graft Dr. Alfred to repair the injured knee ligament must have an opportunity to mature and to stabilize. And although Dan is raring to get back on the tennis court, he's aware of the importance of faithfully doing his exercises.
And always do your exercises, because it's only helping you, you're helping yourself.
The credo of Sports Medicine Albany is that he who is faithful to his therapy program can be restored to nearly new status after an injury. Dr. Doherty and his partners have recently published the results of their pioneering work in the use of artificial grafts for the repair of Achilles tendons. This innovative technique has been extended as well to other aspects of reconstructive surgery, where it has aided in the more rapid rehabilitation of injured athletes. There is also an array of apparatus at Sports Medicine Albany designed to further quicken that rehabilitated status. This is the province of the clinic's director, Tom Fashauer. One of the most impressive high-tech instruments at Sports Medicine Albany is the Biodex. It is at once a diagnostic tool and a rehabilitation device.
Mark had a problem with his disc in his back, and he had some disc surgery. And now what we're doing is we're trying to strengthen Mark's back. And this attachment is our back attachment for the back Biodex, which is an isokinetic exercise and testing equipment. Mark, why don't you do a couple here and we can demonstrate what we're doing. We can set the speed at how fast Mark is going to go forward and back. We can also change the forward speeds of the back speeds if we want to work more on flexion or extension with Mark. Why don't you do a couple and we'll show everyone what you're doing. Cross your arms right in your chest, and we'll turn it on. We can limit Mark's motion, how far we want him to go forward and back also, depending on his condition. We'll also test Mark. We've done that several weeks ago, and we'll test him again in another 2 weeks or so. Tell us how much he's producing in flexion and extension, and then we'll use those to plug those into our national norms. We have some set norms for him to return to playing basketball or to work or whatever, and he needs to fit into those things before we're going to allow him to do that.
Of course, machines are only as good as the people who operate them, and the testing results are only valid when interpreted by licensed professionals. That's why underlying all of this sophisticated equipment are the talents of some very knowledgeable people.
One important thing is that on staff at Sports Medicine Albany is we have several certified athletic trainers as well as several registered physical therapists. Most sports injuries are amenable to some kind of physical therapy or some kind of therapeutic exercise. In our facility at present, we have the capability of doing computerized testing of different muscle groups, computerized strengthening of different muscle groups, Nordic ski tracks, Nautilus-type weight machines, computerized strengthening to upper extremities, such as elbows and shoulders.
Sports Medicine Albany is interested in the athlete from the cradle to the grave, literally. And we define athlete as anyone who is running the race of life, so I think that includes all of us. Our emphasis is to help the individual find what sport is or activity, sport or activity, is best suited for them. Help to find or help to identify any problems which may relate to that sport, help the patient correct it, and then in various ways, mostly educational, help the individual to get started in that sport to pursue it safely.
Conservative, I think, is a very good definition. Many of us, myself included, tend to be conservative in our treatment of most athletic injuries. That's because most athletic injuries lend themselves to conservative management. The young, very active athlete with a destroyed knee, if I can use that terminology, will tend to lean more towards and be advised towards earlier surgical intervention to enable that individual to return back to sports at a faster rate. Many times with ligament disruptions, surgery is absolutely indicated when instability and disability become a persistent problem. In those situations, surgery may be the first route that is recommended. There will always be a place for conservative management, and I think as we look at the older population of those with sports injuries, conservative management, by and large, as long as we're not dealing with fractures, is the rule of thumb.
A truly superior medical practice serves its community best when it offers educational as well as professional, clinical, and rehabilitative services under the same roof. The physicians of Sports Medicine Albany are committed to preservation of health and, when necessary, the restoration of health through advanced medical understanding.